you for joining us for today's educational webinar with Cancer Support Community Los Angeles. I'm Kathy Riley, the Associate Director of Programs at CSCLA, and I am really honored to welcome you to this week's webinar, which is titled Integrative Healology Approaches for Your Journey Through Cancer. And before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization that provides vital social and emotional support to families facing cancer. And that includes patients and caregivers and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you'd like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. And before I introduce today's speaker, note that your video and microphone are automatically disabled for this webinar. You may, however, enter questions into the Q&A feature found at the bottom of the Zoom window at any time. The webinar today will be interactive, and there may be some time for specific questions at the end, but we will see when we get to that portion of the webinar today. And I want to ask our speakers to come on, Dr. Salles Araujo and Dr. Justin Laube. Please join us and welcome. We're really excited to hand things over to the two of you today, and we'll be here in the background if you need anything. But I'll see everyone at the end. But welcome and thank you for being here today.
Thank you. We'll get the slides up and then we'll start.
Welcome. Okay.
Yeah, let's get started.
All right. Welcome everyone to our talk on Integrative Healology's approach for your journey through cancer. I'm Thais and
I'm Justin.
So a little bit about who we are. I'm an internal medicine, integrative medicine, palliative care and hospice physician, medical doctor. I'm trained both in Brazil, where I also did fellowship in medical acupuncture, and also here in the US at UCLA. And I work extensively with patients with cancer, and touch of also not just my professional, but my personal connection to cancer is going through this journey with my dad, and who has passed away. And I dedicate this lecture to him.
Thank you. And I'm Justin Laube. I'm also an internal medicine doctor. I only trained in the US, not in Brazil. And I'm also trained in integrative medicine. I trained at the UCLA Center for East-West Medicine. I learned acupuncture and other holistic approaches to care. I'm from Minnesota. I'm trained there at the University of Minnesota at their Center for Spirituality and Healing, which is a very seminal time for my development. And my focus area is also around healing from difficult diagnosis, as well as from trauma and unwanted experiences when one is younger. And so I'm focused on the healing path, and I'm really excited to be here and also share my experiences from taking care of patients with cancer at East-West Medicine and their healing journey.
An outline so you can know what to expect on this talk. We'll start with an arriving pause so we can all come together here. We'll define healing versus curing. We'll go through what is a healing as a process, as an arc. Then we'll dive into direct explorations into healing approaches such as acupressure, qigong, nature therapy, dignity therapy, and psychedelic assisted therapy. And we plan to leave space for Q&A at the end.
So let's practice arriving. So if you're able to, on that driving, I invite you to let your eyelids close for about a minute or two as we together practice arriving here, arriving now, Noticing breathing is happening here. Breathing in the body. Noticing a body is sitting, or perhaps you're standing. Noticing whatever in your body is resting on. So that could be a cushion or the floor. Back, hands, anything touching in your sitting or standing. Noticing your chest, your heart. Feeling into what you came here for, what you are seeking, what you are exploring, and what brought us here together for this webinar. And what comes up with you, what comes up within you around the term healing? What does healing mean for you? What is the essence of healing? Inviting words, images, whatever emerges or doesn't. And as we finish this arriving pause for 2 minutes, I invite you to type in the Q&A any words, a couple short snippets of what healing is for you. Feeling whole, wholeness, peace in my body,
Peace, restoration, balance to mind, body, spirit, calm,
finding wholeness and balance.
freedom.
Thank you.
Thank you. Peace, relaxed, and no fear. Thank you for sharing.
So I invite you to continue typing throughout the talk. What is healing for you? And engaging with this.
So here is a patient and case to illustrate. So Lily is a 45-year-old woman who was previously healthy and was recently diagnosed with stage 3 breast cancer. She's currently undergoing chemotherapy along with a planned mastectomy. She's a dance teacher, hasn't been able to work currently. She's divorced and lives with her 2 daughters. She visited with a palliative care doctor as part of her oncology team for fatigue, which is tiredness, anxiety, and insomnia. And she has fears around everything: nausea, post-her chemo, and headaches. Her oncologist and primary doctor evaluated her and had already prescribed 1 medication for each symptom: Ritalin, Lexapro, Zofran, ibuprofen, with variable responses. She wishes she could go back the way she was and is struggling with her symptoms, treatments, and how to manage. Does this history resonate, remind of yours, or of someone you know and care for to some degree? So going to the definitions of healing, starting with, so it sounds like what Lily is looking for is this feeling of healing. Looking at the dictionary first, you already brought up the essence of the word. To heal. Heal means to make sound or whole. Comes from this Old English root heil, which means the condition or state of being whole. Hal is also the root of holy, which is spiritually pure and sacred. So very interesting how all those aspects of healing already came up from your answers. And it's also the shared root for the word wholeness, parts of a whole that are intimate, interconnected, physical, mental, emotional, social, spiritual, and nature all. If you Google images, the word healing, those are some of things that may come up. So you may see often this image of hands, light, pastel-like colors. Wonder if those visualizations resonate with what healing means to you too.
So one way to look at what healing could mean is asking people who do a lot of work with healing. So one researchers did an interview study with 7 practitioners, MD allopathic doctors that really engage with healing and have studied this and worked with patients going through that process. So they interviewed them, and some of their definitions for healing are making whole again, becoming whole again, finding wholeness, well-being and function, a state of mind, a harmony between the mind, the body, and the spirit, and a spiritual experience. And they categorize them by themes of wholeness, themes of narrative, meaning that healing occurs in the present moments of one's life and has characteristics to it. And also noting that healing can have a spiritual component, spiritual, not necessarily religious, although for some it could be religious, but more about meaning, purpose, and what it is to be a human being.
To put into quotes, also as further invitations so you all may see what resonates, what feels true for you. Healing isn't as much about getting back to the way things were, but about learning to live with how they are now. Ram Dass. Come to me, all you who are weary and burdened, and I will give you rest. Take my yoke upon you and learn from me. For what I am gentle and humble in heart, and you will find rest for your souls. This is from the New Testament.
The wound is the place where the light enters you. Your task is not to seek for love, but merely to seek and find all the barriers within yourself that you have built against it. Rumi, who's a Sufi poet. The Misha Berach prayer in Judaism, traditionally recited for someone who is ill, asks God for refuat hanefesh, healing of the soul, spirit, and the whole person, and refuat haguf, cure of the body. To cure the body means to wipe out the tumor, clear up the infection, or regain mobility. To heal the spirit involves creating a pathway to sensing wholeness, depth, mystery, purpose, and peace. Cure may occur without healing, and healing without cure. This is from Rabbi Nancy Flom. So we're alluding to this concept of curing and the illness orientation. So we all know this because this is cancer, and this diagnosis would fall under this diagnostic orientation of modern medicine that we understand as medicine. Curing is defined as recovery or relief from a disease. Something such as a drug, a treatment, surgery that cures a disease. This is what medicine is really powerful about, modern biomedical medicine, finding the problem and curing it at the body level. What often is not described is some of the biases of the view, the glasses that are worn by biomedical practitioners that are focused and hyper-focused on curing. Some of that orientation is that they see we, as trained in this, see the body as more of a machine, as DNA, as cells, as has infections, and looks at it in a very microscopic, reductionistic way. All the specialists, different organs, this is just part of what we think is common. There's also a mind-body dualism where matters of the mind, emotions, spirit seem to be separate from that body experience. They seem to be less prioritized, kind of allocated somewhere else. So I think it's important to know that they are classes and there are other classes to explore. So if you're trying to heal, it might not be through purely the biomedical model, but in partnership with. And medicine is really, really good at naming it, blaming it, and taming it. And thank goodness if you have a stroke and you need an acute cardiac intervention, that medicine is there. It's a beautiful art. There are other ways that might be needed to be engaged to heal. Other holistic systems, meaning healing systems that exist, include the body and include nature. So some of them being like traditional medicines, which don't split the body, mind, spirit, or soul, and they don't separate the individual from all the fabrics of their social connections, nature connections, and nature itself. That can be indigenous and shamanic forms of healing, traditional Chinese medicine at its fundamental base, and Ayurvedic medicine, including yoga and those practices. One example of this on the right are two Chinese characters. For on the top is cancer, and the bottom is heal or cure. So you can see here in the image of this, the character includes different components. The first, this shape like this on the top is signifying a cliff or a steep place, and the bottom being a mountain. And this is representing cancer as being a formidable, challenging experience with some weight to it. And there's also the three squares, meaning multiple mouths or openings, referring to the multiplicity of cancer and its growth and its consumptive nature. The term for the character for healing and treat includes also elements of nature, including the three splashes, which is water, signifying healing is a process over time, requires flow, and as well as this stable platform bringing balance structure to the character. So this is an example that even in the characters of the language, Chinese medicine and Chinese culture includes natural elements differently than we do in our language.
So again, we were talking about lenses, right? So here on the left, it's the lenses towards curing, seeing the body as a machine. And when you turn to the right, it's a different way of seeing the body as a garden. What would that be like? And how can these two live together, healing along with curing? So through a holistic system view, the body as a garden is what is ripened for healing. First is seeing that our body is interconnected with and part of nature. We are mostly made of water. We have fire element, the heat that our body produces. We have minerals in us, our bones, air coming in and out through our breath, in the space in our lungs, in our belly, the earth living in the firmness, the solidity of our body. The body as a garden, it's about cultivating health over suppressing illness. It's about nourishing and tending to this garden. It's giving it sun for energy, it's giving it the moonlight for rest, it's giving it like meditation, prayer to nourish it. It's giving it foods and nutrients and connection. It's acknowledging, the body as a garden is acknowledging the body's wisdom and ability to rebalance and self-regulate. Just like a tree may come into seasons, leaves may fall, there is time for flourishing, there's time for flowers, and there is time for pause and rest. So with that, we will see the invitation to see the body as a garden is to see ourselves and your healing team as gardeners who activate and invite this innate healing intelligence to balance and flow the energy within your body. within our own body.
So going back to our case that's unidentified, it's not a specific person, but a group of patients we've engaged with. So Lily, here's a healing orientation, a map of life in a way. At some point in her life, she gets this message from her doctor to tell her, I'm sorry to let you know this, but you have breast cancer. This occurs in the now, the present moment of that moment for her. In the context of previously past healthiness, which I'm sure you all understand this, there is this past, and then suddenly things are different. Could be denoted as a wave, or so this would be an unwanted experience. And then it opens up this whole perspective of what does this mean for my future? What does this mean for my entire life? So one way to understand curing and healing is to separate them out a little bit. So first, she's getting a diagnosis of, I have cancer. She's going to pursue treatment, evidence-informed, best care possible, with the intention of curing. Hopefully it'll be curable, or get into remission, or enter into survivorship. Potentially it isn't. The state that she's in at that moment is she doesn't have the cure yet, so therefore she's kind of like uncured at that point, and she has a disease. She's diseased. Where would healing, or where would absence of healing fall? So at that moment of the shock of that, the threat to who she is, what does this potentially mean for her as a mom in her life, comes up a lot of fear of loss and actual loss throughout the treatment. Fear of change, as well as actual change, as well as doubt. There can be purpose, disruptions of meaning, as well as the big one is fear of dying, or what this means in my life. And it can have different meanings for different people. And this can also be stacked on other challenging experiences growing up that might have limited one's ability to heal in a deep way or have some emotional challenges. That author that interviewed the different MDs about healing also offered a summative conclusion definition. And they said, healing is the personal experience of the transcendence of suffering. So one way is to potentially see that top zone as suffering, unwanted, challenging, and somehow making it through to some other side, or working with it and incorporating it in some way, in a meaningful way. One way to understand healing could be through understanding mythic orientation, meaning mythology, not a lie, but like the stories of ancient stories. So practitioners and researchers have studied these, and these stories they're pretty much the basis of every Disney film. There's a separation, you leave one's life, then there's a initiation, some big moment, and then you return with some new information, and you're different in some way, but you're the same. So that could be like, for Lily, the call of unwanted, you have breast cancer, the separation and leaving one's home into the darkness of medical care, and the confusion and disorientation of where this is going, where you're facing truth, facing mortality, facing change. Then there can be a form of darkness that can occur, like a caterpillar going into its cocoon before it's going to transform, where they meet allies, they take risks, they find support through that process and transform it a little bit, meaning maybe face a little bit more about what my life really means, maybe shifting. And then there can be this transformation, return with a new narrative, growth after understanding one's diagnosis, as well as whatever happened during the transformative process, and then return and start again, and back to that arc. What is needed next for one's healing and curing. Some key ingredients that some journeyers have found on their healing path that we have heard and studied are: one, key ingredient, connection with other beings in a field of truth, authenticity, and emotional safety. So that could be taking the risk to really share honestly and truth for people who you can trust, therapists, other people, or loved ones, or a good friend. Energy access. Healing takes energy It takes energy and it takes hope that there's actually a potential to return to more wholeness, regardless of whether my diagnosis does this or that. Healing is a windy, nonlinear path. Be patient, trust the process. Healing, we may want it to go like this. If I have a loss or grief, I want to go through the motions and then I'm healed. But unfortunately, healing is windy, goes forward, goes back. So if you're disoriented and you feel like you're going forward, going back, then you're likely on the healing path. Another is the body is oriented towards the body. The body, not just as the body as an alive, dynamic, emotional, memory-holding vehicle, and to live one's life in a way that's caring for this vessel and be open to the awe and the wonder that could exist in this gut that digests our food and we don't know how it happens. And another component is spiritual openings. It's not uncommon for people to commit to this healing orientation and to find a connection to something or a realm beyond oneself. It can feel like awe, it can feel like new meaning and purpose, it can be a mystical experience. So these are the features, and in the middle is oriented towards, these occur both linearly, non-linearly, and in the present moment awareness and being in one's body in the present moment that we practiced earlier. And where are we trying to get, when we're trying to heal, it's really the operation, trying to find wholeness, trying to find healing, trying to find reintegration, trying to find reconnectedness, and forgiveness or reconciliation can occur on this path for self and others, as well as feeling loved, accepted, and at peace and at ease, and to rest and be oneself. So with that in mind, we want to move into some specific integrative healing practices that can open the little door to engage with the body as a garden and engage with the body in a more healing way. So one is acupressure. Acupressure is part of Chinese medicine. Acupuncture is the needle form of it. The concept is to apply pressure to acupoints on the body, and acupoints are considered reservoirs of energy in Chinese medicine, of qi, which is a vital energy that moves through the channels. And so disease and symptoms are considered disruptions of flow. And by pressing and engaging with the body, you can support that flow. There is research on self-acupressure for patients going through cancer for symptoms like nausea, vomiting, fatigue, insomnia, and quality of life, depending on the points and what's safe. So we invite you to practice a short blip of this to see to experiment. So here we have, I invite you to put your fingers like this and putting your thumbs on your temples. If you have glasses like me, kind of wiggle around. You can rest your fingers here on your forehead. And I invite you to make a circular motion, applying the pressure that you need to really feel this area. And then explore, switch directions. I know I can feel like I'm really doing this right now. So I invite you to connect in with your breath. See if you can find a few percentage points of relaxation and disconnect with the sensation. And with these fingers here, I invite you to bring them on the forehead and along the eyebrows. And you can rub out towards that point. So this thumb point is Taiyang, and these finger points are GB14 and BL2. These are acupuncture points. And now I invite you to put your hands on your hair. If you're at work, maybe don't do too much. And then here in your jaw, taking a deep breath in. And sensing into what your face and your body is feeling like after this short 30-second exercise. I know I'm feeling tingly. And I'm smiling. So that's something's shifting. So that's one example of a way to start engaging with the body in this more holistic orientation. Another practice from Chinese medicine, which is one example, is Qigong. Qigong, Qi, like we just referred to, is the vital energy. It's really being alive, the heat and the energy in our body. And Gong is cultivation, or working with that energy to support flow and accessing source. Qigong is a Chinese health and healing practice to support flow. It's often done relationally, kind of like we're learning together right now. It's done often in a park and often engaged with nature, and many of the forms involve nature. And what's fundamental, like yoga, is that it's moving with the breath. The breath moves the body, and the body is moving the breath. So there are studies too, specifically on Qigong for cancer-related fatigue, which makes sense because it's oriented towards moving type of energy. So I invite us to practice chair or very simple yoga that can be accessible to you. So that can look like beginning, eyes slightly open for this, noticing your body sitting or standing. So that means like feeling into the posture of the body and posture in relationship to this gravity that seems to be this direction down, and the body that seems to keep itself up on its own. We'll call this proprioception. And if you lean forward, you can feel kind of the energy maybe unbalance, this dropping into the relaxation in this upright posture. Now connecting with the breath, this engine of breathing. And then we're gonna invite you to breathe in with your arms lifting up. So we'll do this 3 times. So breathing in, arms up. Breathing out, the relaxation of the body. The body knows how to go down. Breathing in. Feeling the air above, spaciousness, and letting it go. Last, breathing in, shooting really for 70% effort. So it doesn't need to go too high up, just relaxing the shoulders and breathing out. Putting hands on the belly area and up here on the belly, your center. And now we'll just do a couple of breaths here, breathing arms out like a T, opening the chest, breathing out, bringing your awareness to the breathing. It's sinking, breathing out. Now this last one, just let it happen. No need to do anything. Just staying. Tapping the chest, shoulders. The sensing again how you're feeling in your body. For me, I'm feeling energy and my shoulders seem to be coming up. So they're really up. So that's very interesting. So next, another integrative healing practice is, it's been studied that patients with cancer seem to really do well in nature, forest, beach, something that feels really natural. And one study that reviewed 12 studies of almost 3,000 patients going through cancer and some degree different diagnosis, found that being in nature offered improvements in anxiety, depression, sleep, feeling of connectedness, stress, confusion, fatigue, and pain. And a key component to that is engaging with nature with some pause, potentially a timer or a guide, some way to frame it so that the awareness can come up. So it's like, I'm not just walking in here to do something. I'm sitting and resting or engaging with nature to learn nature as more of a guide. So that can also be done in the comfort of your own home, sitting with a plant, setting a timer, and feeling into its nature, its living nature. It can also involve being near the sun, looking at the moon, getting out of the city into the desert landscape, or just going on a stroll in the evening. So, and it's a means to really remember potential that we are both of nature and could potentially be resourced by it, and that we're not alone in this healing path. next step.
Okay. Now I'm going to go over some integrative healing practices that are specifically more focused on reconnecting with this meaning and purpose throughout a life-threatening illness. One modality, I would say, it's called dignity therapy. There are many different therapies that relate with this intention to connect with meaning and purpose, such as logotherapy, existential psychotherapy, meaning-centered therapy. And this one that I'm pointing, dignity therapy, is a little bit of an amalgam of them. And it's just happened with 1 to 2 sessions, and it's a set of reflections done in dialogue with specific prompts. And it's often done, like I said, 1 to 2 sessions, and it's recorded so that this can be turned into a document that it could be a legacy project. And it lives a lot in this palliative care realm with palliative care providers, social worker, physicians. And also it's something that potentially you can Google the questions and invite someone you know and trust and feel comfortable with and just go through it. So some examples of this kind of questions around meaning include, what are the most important roles you have played in life? And invite you to reflect on that. Family roles, vocational roles, community service roles. What have you learned about life that you would want to pass along to others? This dignity therapy has also been extensively studied, and particularly with patients with cancer in different stages and phases of their illness. And often what people have shared that they learned through this process and from cancer is 3 key components. It's about it's an invitation in the teaching of like learning reframing life's meaning, reconnecting with it. It's about developing resilient coping strategies to be with. And it's about cultivating connection and love. Some quotes from patients who participated in a study were, especially in bad things, you must not give up and you have to see the positive side. It seems strange. A lot has come from this disease. It has given me a perspective that I had lost. Often, when everything goes well, you lose yourself. There are qualities like love, faith, and hope that never go away. The most important quality I learned from life is love, because it's the most powerful thing we have. If you don't have love, you're only an end to yourself. Now, moving along to other healing practices on the space of meaning, which include psychedelic and mystic experiences. So psychedelic has been kind of trendy right now, but I wanted to go back on like the root of it. So the essence of the word means psyche, mind, or soul manifesting. The experience involves this altered senses, which often described as like connecting with this non-ordinary reality or an altered state of consciousness that often brings this sense of feeling interconnected, that transcends time and space and may bring this felt sense of sacredness. Some examples are natural ones are psilocybin mushrooms, ayahuasca, which is a tea brew from Amazon plants, human-made such as LSD and ketamine, which is the only currently legal in California. And also want to highlight that this may be produced endogenously, like by our own body. Particularly, there are theories that DMT, which is present in plants such as the ayahuasca, is found in our human body through some practice such as prolonged meditations and retreats, breath work, shamanic journeying through drumming, guided, ecstatic dancing, and meaningfully deep, profound spiritual experience such as giving birth, the natural dying process, and in religious ceremonies. Also, it's part of that trauma can happen on moments of trauma healing, mythic adventures when there is like an emotional breakthrough. traditionally, like humankind has been using this connection with non-ordinary reality as a pathway for healing since we are hunter and gathering societies, through the origins of shamanism, through practice of rituals and ceremonies. In the context of cancer, it has been studied for patients with significant anxiety, depression, and existential distress, which is like this profound pain and loss that comes from loss of meaning and purpose in life. So how does this work? Like, what happens in our brain? What are the mechanisms? Could give a whole talk on that, but in summary, three key things. First, there is a turn off of what is a system in our brain called the default mode network. That is our constant thinking, ruminating mind, maybe how your mind is right now, thinking of what to have for dinner or what to do next. And when it turns it off, it can open up deeper structures, memories, and help belief and resources. It increases brain entropy, which is this interconnection between the brain regions. On your right, you can see this is an image from a study comparing on the top, our brain at just normal rest state, and in the bottom, our brain under psilocybin mushroom. And the connections, the lines are the connections between different brain regions. And with that, what happens is that it creates a window of neuroplasticity, which is a possibility of letting increase in perspective, flexibility in thinking, and emotional processing. Curiously, deep meditation and awareness practices, such as we've done through the course of this talk, have also shown similar effects on our brain. So going a little deeper on like how does that actually happen on this medical modern model of psychedelic assisted therapy. This is a photo from John Hopkins study on psychedelic research on the use of psilocybin therapy for patients with cancer. And there's important pieces are the set and setting, which set is about the preparation and intention setting around the use of this therapy and this relation with the medicine. The setting is about the place where it is. You can see it's very different from a clinic, our usual medical office. It's more like the home environment, because we know that like feeling safe has such an important impact on how the treatment goes. There is usually two therapists or facilitators, and there's music involved, there's eye shields. And this is the example of the treatment phase. And after that, there is an integration, which is like making meaning and reflecting on the experience. Then this is an illustrative image picturing how psychedelics are used still traditionally. Particularly, there's a representation of ayahuasca ceremony, which usually involves a group of people meeting in dusk time, and there is a fire element, there is often drumming, there is often chanting, and it's been part of like a way of healing of humankind. And also there's a lot of research, particularly in cancer population. Here are some just to illustrate. On the top left is a study from NYU. And then on the bottom left is some review on ketamine for depression and cancer. And on the right, there's just to see there's a lot of scientific evolving landscape, and there's an open clinical trial for patients with pancreatic cancer at UCSF. And hopefully soon there will be starting to enroll hopefully patients for psilocybin, study comparing psilocybin and ketamine for patients in palliative care at UCLA and CSF. So this is a very evolving legal and scientific landscape that currently it's on hold, some of the studies there because of that. So we're getting to the end of our talk.
Time for questions.
To allow time for questions. To close this space and circle, wanna want to read through together a poem, part of our actually psychedelic training, and I invite you all to close your eyes if you feel comfortable to feel through these words.
Breathing.
Rivers of power flowing everywhere.
Fields of magnetism relating everything.
This is your origin.
This is your lineage.
The current of creation is right here, coursing through subtle channels, animating this very form.
Follow the gentle touch of life, soft as the footprint of an ant, as tiny sensations open to vastness.
Power sings as it flows, electrifies the organs of sensing, becomes liquid light, nourishes your entire being.
Celebrate the boundary where streams join the sea, where body meets infinity. And opening your eyes. Well, thank you for coming to this intro to our evolving model of healing. We are part of starting this Institute for Integrative Healology, the science, the art, and practice of healing, and really focusing on guiding and teaching patients, people, ourselves, families, through transformative experiences towards reconnecting with innate healing and finding peace and ease. And I think, should we do Q&A now, or?
I guess.
Okay, we'll just a quick blurb about us and we'll do Q&A. I know we have time, which is great. So we have a website that we will be birthing soon. It exists, Integrative Healology. And as far as we're finding our way soon to be offering healing virtual visits, medical visits, group visits, potentially also at home is the plan. Also offering educational activities, family groups, retreats. And we are starting to work at a clinic, Modern Medicine Services, that's in Burbank. If you're in that area, we'll be providing integrative care, acupuncture, and that clinic also offers psychedelic-informed therapies. And so this is the beginning of our journey of offerings. That's an evolving thing, and appreciate you being here. And now we're open to questions, and this is a cat that happens to live at our shared home. His name is Teo, and he's asleep right now in the bed in that exact position. So we open up to questions, and yeah.
Well, I want to thank both Dr. Thais and Dr. Justin for being here, and please enter your questions in the Q&A, and they can field those for you. And I love that we have a cat as part of our discussion. There's something very soothing about seeing that on the screen. We've received a few questions. And do you guys want to take a look at those? I'm happy to field some of these to you as well. I know someone was asking for book suggestions for people going through chemo and dealing with cancer, and that your talk was really amazing. And
some of those we can, after the talk, we'll send information more about who we are, and we can include some book suggestions and follow up to we'd have to look some of those up. I do see a question: is Qigong and Tai Chi different? Qigong would be the branch overarch of working with Qi, and Tai Chi is the martial art form of it. So it's a form of it. So, and if you look at Qigong and you're searching, you'll see different practices, different masters, different lineages. Some are more animal oriented, some are healing Qigong. So there's some complexity to it. If you're looking for very gentle movements, connecting to breath, Qigong is a good start. It's the fundamentals of Tai Chi, and then you can engage with Tai Chi, which has more like learning specific forms. Yeah, so Qigong would be a good start. I see some about ketamine therapy in cancer patients where anxiety and fears may impact the mindset and thus the experience.
Absolutely, yeah. So part of the ketamine assisted therapy is like on that preparation session. It's about going through fears and anxieties around like what is present and about the experience. So it's preparing for it, and then about the mindset is like if you're suffering through anxiety and depression, like this, and the intention is to go to the therapy to work through it, right? So this may emerge, but being with someone, being with someone facilitating the experience may give you that opportunity to go through those fears and emotions, but supported. So yeah, does that make sense?
Yeah.
Yeah.
My primary practice personally in my own healing from complex childhood trauma, for me has been through meditation, which I would define as practicing pausing, practicing being with the present moment, which seems like it should be simple, but for me, it's like on a roller coaster. The present moment has so much energy. But I'm getting at that a practice, whether it's psychedelics, meditation, spiritual practices, whatever can allow all of you to be welcome there in however it wants to express itself is healing. And trauma occurs through and challenges with expressing emotions come through trauma, which is the unwanted experiences that occur relationally. And to heal from trauma and to heal from challenges is also relationally. So that can be through that can be through the psychedelic process or through good friends, time away and engaged in honest, true, heartfelt connection. And that takes courage. If you have never done this with some friends or whatnot, that's a learned process to be able to share in that way and to find relief. Therapy is really helpful for me too. Trauma-informed therapy that involves the body.
Yeah. About the Burbank Clinic, it's something there. Yeah, my first day there will be on the September 6th.
Yeah, maybe we could some of the logistics.
Yeah,
some of these will
questions we can answer
keep
through
these
email.
and we can send through email.
That would be terrific if you
yeah.
are interested. You can reach out to us. I know Abby put the email in the chat, the info@cancersupportla.org. And please feel free to email us there and we can, certainly get additional information to you. And I see an insurance question too. Will you take insurance? And we had some insurance questions at registration, particularly for affordable integrative care for seniors on Medicare. So can you address that?
I have a list of like resources online, definitely on like, for example, good Qigong practice that you can engage with, and also just more information. For example, I can send on this dignity therapy space. And
yeah, I think this is where there's a bit of a challenge where the medical care, the insurance model is curing 1, 2, 3, 4, 5. So some of these healing arts are just not reimbursed. They're just not viable. So beyond maybe group medical visits have been tried, but the integrative medicine world is hard. So right now, the majority of these services are outside of insurance or sliding scale. And people are just trying to navigate how to offer these services because they just seem that they're not embraced fully financially or insurance-wise to have it be a viable, because these things take time and effort. So there's a bit of a grief and a loss in that it just can't be part of the mainstream. But there is an integrative medicine movement, policy, drumming, but it's really hard. It's just like teeth and nail trying to with the insurance company. So we right now are not engaging with the insurance world because we're seeking to have the full expression of ourselves as healers. And we hope to offer all different mechanisms for people to engage with us in whatever is viable or possible.
Yeah.
That's what we're
Yeah,
envisioning.
we do have a vision of having a group series, which that creates a lot of affordability. And we are just starting, and I'm happy to hear you're excited, and I hope to connect with you all.
Yeah.
And I have some other questions here. Do you want to cover?
Do we have time, Kathy, or are we?
Yes, please go ahead. I see there are several really wonderful questions, and let's just take some.
Maybe you could you read one that you're seeing?
Yeah, there's one question that says, we all know that holding on to anger, hurt, and resentment affects our healing negatively. And Justin, you addressed this a little bit, but maybe just talk a little further about any tips or suggestions on how to let go of these to help facilitate healing.
Yeah, I can share about that. The conceptually and knowing it can be harmful to hold on to these anger, rage, resentment, and yet they're here and they don't seem to be flowing out of my body. So the inquiry is actually, what is happening right now that it's not just digesting, it's not transforming. So this is the hallmark of trauma-oriented therapy or these therapies where one is supported, or even through psychedelic, to, instead of thinking, this shouldn't be here right now, is to give it space to express itself. That could be through feeling like it's a part of you, or it could be through sound or different ways, so that it can speak and one can engage with it and cure it and say, what happened? What really hurts? And oftentimes growing up, that was never given space. So it kind of sits like the wound. So that the mythic orientation is not doing this not alone anymore, getting help and supporting it, and knowing that it will move when it's ready to move. It's a different orientation. So it's this dance of longing for it to go away, but the reality is it's here. So that is usually mediated through safe, healthy people, groups, group sharing, support groups, where you can really bring yourself, or on retreats or deeper experience, or if it really feels blocked, potentially psychedelics, which adds a little bit more volatility to it.
Thank you so much for sharing that. And just thank you for sharing really the full scope of what integrative healology means. I know I learned much, and our participants learned so much, and you can see some of the wonderful comments, people thanking you, because this topic isn't covered a lot, and we so appreciate you both providing this additional information and sharing so deeply and profoundly with us today. And if you would like a copy of the slides today, you can email us at info@cancersupportla.org. And then I see some questions about Qigong classes. We talked about support groups. All of those things are available at Cancer Support Community as well. So take a look at our website, and that is cancersupportla.org. And you can explore that website and find some resources that were talked about today on our website as well. And then why don't we have Justin and Thais, maybe you could stop screen sharing and we'll put up the last slide. And any final thoughts from the two of you before we share the final slide and sign off?
Grateful for this opportunity to meet you all, and the opportunity to share, and wishing all the well for all of you.
Yeah, me too. Thank you for being here. I see you as the personal experts in helping guide this model, so it's applicable. So thank you for engaging with us and sharing, and look forward to hopefully connecting with you more in the future.
Thank you. And Abby, if we could have that final slide. So again, if you want to learn more about us, here's our website for questions. You can email here. We wanted to bring your attention to an online class that we have called Mindfulness as a Medicine. This class does some of the things that were spoken about today. It has some cutting edge mindfulness practices, integrative models of health and healing. Our instructor for this class is very experienced, and it takes place on Zoom every Tuesday from 4 to 5:15 p.m. You can register if you're already a participant at CSCLA. You can register using the QR code to the right. If you're new to CSCLA, we ask you to take our orientation before you sign up for this class, and there's a QR code there as well. Thank you to our speakers again. Thank you for sharing so generously and giving your time to all of us today. And we hope to see all of you at a future webinar. Take care. Thank you, everyone.